Dear students, welcome back. In the previous session, we have discussed about the structure of the knee joint. In that knee joint bursae, we have discussed in the previous session. Now in this session, we are going to discuss about the knee joint function. Okay, normally this knee joint function mainly includes the knee joint motion. Okay, here we are going to study the knee joint motion in two aspects. One is osteokinematics and arthrokinematics. Osteokinematics includes the degrees of freedom, whereas the arthrokinematics include intra-articular movements within the joint. Okay, now we will see what are the knee joint movements or knee joint motion. Okay, the primary motions of the knee joint are flexion, extension, okay, which is occurring in a sagittal plane in the coronal axis. So this is the one. Okay, next, and another, to a lesser extent, you'll have medial rotation and lateral rotation. Okay, these motions occur about changing but definable axis and serve the weight bearing functions of the lower extremity. So again, the main function of the knee joint is weight bearing. Okay, the knee joint can also undergo tibial or femoral displacements. So that means, what do you mean here? You want to understand here is either tibia will move anterior or posterior on the femur, or this femur will move anterior and posterior on the tibia. Okay, so this kind of movements will take place in a closed kinematic chain and in open kinematic chain. For example, it is an open kinematic chain. The tibia will move on the femur. Okay, in closed kinematic chain, tibia will move on the femur. Okay, if it is an open kinematic chain. If it is open kinematic chain, tibia will move on femur. If it is a closed kinematic chain, femur will move on tibia. Why? Because the tibia is fixed on the ground with the foot. Okay, then femur will move on the tibia. Okay, that is called as and also it causes some anterior and posterior femoral translations, we can call it as. So such kind of movements are taking place in the knee joint. In the knee joint motion, we have to consider flexion and extension are the primary movements, internal rotation and external rotation to some extent, and there is small anterior and posterior translations we can see. Okay, both on the tibia as well as femur. That means anterior and posterior translations of the tibia on the femur, or anterior and posterior translations of the femur on the tibia. And also you can find some kind of movements, that is some abduction. Okay, we can see abduction and adduction also. So through it is not occur naturally, but it occurs due to valgus and varus forces. Okay, so if you see here, if you apply some valgus force, so if you apply some valgus force, what is happening? The tibia will move away from the midline, which causes abduction. Okay, now if you apply varus forces, so if the force is applied to this varus force, okay, then what is happening? So the tibia will move towards the midline, then it causing adduction. Okay, so normally these movements are generally not considered the part of the function of the joint, but but these are rather a part of the which is the cost of the tremendous compromise between mobility and stability. The small amounts of AP displacement, okay, small amounts of AP displacement and varus and valgus forces that occur in the normal flexed knee or the result of the joint incongruence and variations in the ligamentous elasticity. But the primary motions are flexion and extension, internal and external rotation. The anterior and posterior translations and abduction or adduction is seen due to the result of joint incongruence and variations in the ligamentous elasticity. Okay, and this magnitude of such motions varies among individuals. Okay, and also it is going to be vary in the same individual from right side to left side. So if these translations and varus and valgus forces, if these will show some excessive amounts, then it becomes an abnormal motions and generally indicate that it is due to ligamentous incompetence. Okay, so these are all the knee joint motions. Okay, now we will focus on the normal knee joint motions, which includes osteokinematics and arthrokinematics. Now first we are going to discuss about the osteokinematics of the knee joint. The first one is the flexion and extension. So in the flexion and extension you have to understand, so I have already explained in closed and kinematic chain. So which bone is moving on which bone in closed and kinematic, closed and open kinematic chain is very important. Based on that only we can understand the arthrokinematics, otherwise it will be more confusing. Okay, now first you see this how this flexion extension takes place in closed and open kinematic chains in the sagittal plane. So here in this pic you can see so here this is an open kinematic chain, this picture. That means the tibia is moving on femur. Okay, tibia is moving on the femur. That means the tibia and the foot is moving in the space, isn't it? So this is the extension, and the open kinematic chain, now it is moving back. This is called flexion. That means tibia is moving on fixed femur, and which causes 140 degrees of flexion. This is the normal range of motion. Okay, tibia on the femur. Okay, so this is in open kinematic chain. Okay, now here you can see, here it is fixed on the ground. Which one? Tibia. Okay, now here what is happening, this is a closed kinematic chain. So the femur, again it is in extension. So the extension may be 0 degrees or 5 to 10 degrees of extension. Beyond the 0 is also considered as normal. Okay, now here what is happening, so the femur is moving on the tibia. The femur is moving on the tibia, causing flexion of the knee. Okay, so that means femur is moving on tibia in closed kinematic chain. So whenever you are studying whether it may be an osteokinematics or orthokinematics, you have to consider this. So that means whether the femur is moving on the tibia or tibia is moving on the femur, then you will get the idea whether it is a closed kinematic and open kinematic chain. The range will not change here. The range is for 140 degrees only. So normally 140 degrees of flexion is the passive range of motion of the knee joint. So in whatever may be is whatever may be the movement, but the range of motion is not changing here. Okay, but you have to keep it in mind, then only you can understand the intra-articular movements. That means arthrokinematics. When tibia is moving on the femur, what it is going to happening? If femur is moving on the tibia, what it is going to happening? So for that only you have to understand this thing. Okay, so you have to focus on this aspect. Okay, whether it is closed or open chain. Okay, now we will move on to the flexion extension ranges. Okay, and instantaneous axis of rotation for flexion and extension and all we will see now. Okay, now so here this is the flexion and extension of the knee joint in various positions. So this one is the standing position, and this one is sitting position, and this one is lying on prone. Then what is the range of motion of the flexion extension? Now we will see. So what is the axis for flexion and extension? Here the axis for flexion and extension at the tibiofemoral joint passes horizontally through the femoral condyles at an angle to the mechanical and anatomical axis. Okay, so it is making an angle with we have already studied the anatomical axis, which is passing somewhat obliquely, whereas the mechanical axis, which is forming along with the weight bearing. Okay, so now the axis will form in between the femoral condyles, below the femoral condyles and the tibial condyles, and it is making an angle with this mechanical and anatomical axis. And also this axis, if you see on the medial side, it is making an oblique. It is not present as a straight. It is making some obliquity, which we have seen in the elbow. The same way here in the knee joint also, it is showing some obliquity on the medial side of the joint. Okay, so because of this obliquity, here the position of the femur is going to change medial and lateral with respect to femur during flexion and extension. So now you can see here, so because of this obliquity, this is the full flexion of the knee. If you see here, the tibia is somewhat medial towards the femur. Femur is present here, so the tibia is moving somewhat medial side to the femur in full flexion. Why it is happening means because of this obliquity of the joint axis. Okay, and if it is in extension, if the same limb is in extension, then what will happen means, so here the tibia will be present somewhat lateral to the femur. Okay, so this is the position of the tibia with the femur because of this obliquity of the axis. Okay, yes. And next, however, unlike the elbow, the axis of motion for flexion and extension at the knee is not relatively fixed. So here the axis is not going to be fixed for the entire full range of motion. So the point of this axis is going to change according to the range of motion of the movement. Such kind of changing causes some various points of axis of rotation So these points are called as instant axis of rotation, and such kind of instant axis of rotation for each point in the knee joint range of motion can be found in a series of X-rays, okay, and the path of the sequential centers are plotted as here in this picture. We can see the pathway of instantaneous axis of rotation. So here the pathway of instantaneous axis rotation of the tibiofemoral joint for flexion and extension forms a semicircle. It forms a semicircle moving posteriorly. So this axis is moving posteriorly as well as superiorly on the femoral condyles with increasing flexion. So it moves posteriorly and superiorly, okay, posteriorly and superiorly when the femoral condyles, on the femoral condyles with increasing flexion. So if the flexion is increasing, this pathway is going to increase. Okay, so this is the instantaneous axis of rotation. That means the axis is not fixed for flexion and extension, but it is going to change on different points on the femoral condyles, with increasing flexion. That means here the axis is going to shift towards the femoral condyles. Normally it is present through the femoral condyles, present at the femoral condyles at an angle to the mechanical and anatomic axis, isn't it? Here it is going to shift posteriorly and superiorly on the femoral condyles with increasing flexion. Okay, this is very important point. You have to note it. Okay. Since many of the muscles associated with the knee are two joint muscles, okay, two joint muscles that cross both the hip and knee. So hip joint position can also influence the knee range of motion. Okay. So passive range of knee flexion is generally considered to be 130 to 140. Okay. Knee flexion may be limited to 120 degrees. So the knee flexion may be limited to 120 degrees or less when the hip joint is simultaneously hyperextended. Okay. If hip joint is extended, hyperextended, then what is happening to the range of motion in the knee? So here the knee joint range of motion is limited to 120 degrees or even less, because it is caused due to the stretched rectus femoris becomes passively insufficient. Okay, yes. Next, this knee flexion may also reach as much as 160 degrees in activities like squatting. Okay, in the squatting, so the knee flexion is going to reach 160 degrees. How is it possible? Here in squatting, we are going to flex not only knee, we are going to flex the hip also. By the simultaneous flexion of hip and knee causes increasing range of motion. Okay, that means it may reach us to 160 degrees. Okay, yes. And if you can see in the normal gait on level ground, the person requires approximately 60 degrees of flexion. The person requires only 60 degrees of knee flexion is required for normal gait. So for stair climbing, that means the person wants to climb the stairs, then the person requires 80 degrees of knee flexion, and 80 to 90 degrees of knee flexion is required, and even more required for sitting down. So sitting down on the chair, it requires more than 90 degrees. Okay, and also raising from the chair, it requires more range of knee flexion. Activities beyond simple mobility tasks require even 115 degrees of knee flexion or more. Okay, now if you see the knee joint extension, normally it is considered to be 0. Sometimes it may be due to 10 degrees is, or from 0 to 10 degrees is the normal limits of knee extension. Okay, if excessive knee hyperextension is seen, that means beyond this 10 degrees, it is considered as genu recurvatum. So how the knee will be? So here what is happening? So the knee is going to bend like this and this thing. So this is the position of knee. When the person will stand, so he will have the posture like this. So this is the genu recurvatum. So the knee joint will go back. Okay, so this is going to happen. Okay, so this is normal. If you see, this is the normal. Excessive pull of this quadriceps leads to hyperextension, or any weakness of the hamstrings leads to hyperextension. Okay, when the lower extremity is weight bearing and the knee is the part of closed kinematic chain. Okay, and if a knee becomes the part of the closed kinematic chain, if any range limitations at the ankle joint may also cause restriction in the knee joint flexion and extension. Okay, so this is the position of a closed kinematic chain. Here knee is the part of the closed kinematic chain. So if any restrictions in the ankle joint movement will also affect the movement at the knee joint. That means it is going to affect the range of motions of joint flexion and extension. For example, a limitation of ankle dorsiflexion. So that means this dorsiflexion is limited due to tight plantar flexors which are present on the posterior aspect. Okay, what is going to happen? This prevent the knee from being flexed. So this one causes, so if the person want to flex knee, what it has to happen? So the knee has to, the tibia has to come forward. So like this, if it is come forward, then knee is going to flex more. But here the dorsiflexion is limited. It is not possible to do like this. Then definitely the knee flexion is going to be affected. Okay, this is one thing. And another example. Okay, so a limitation in the plantar flexion. A limitation of the plantar flexion due to tight dorsiflexors. That means here the plantar flexion is not taking place. Okay, then what will happen? That means what the ankle were fixed. So here the ankle were fixed in the position. So you can see this in this diagram. Here the ankle is fused here. So there is no chance of plantar flexion is going to take place. Then what will happen? The knee would be unable to either flex. So here the knee cannot either flex or extend without the movement of this foot from the ground. Okay, or if the person want to extend the knee, that means he has to plantar flex the foot. So how it is happening? He has to lift the foot like this. Then the person is able to extend the knee. Okay. If the person want to flex, then what this person want to do? Now he has to dorsiflex and then he has to flex the knee, or otherwise he has to lift the entire foot to do all these activities. The person can able to do the knee flexion and extension activity in an open kinematic chain, but it is very difficult to do in closed kinematic chain when this ankle is fused. So these are the things you have to keep it in mind. Okay, so in the next session we are going to discuss about the osteokinematics of the rotation of the knee joint. Thank you.